a drug containing or derived from opium and tending to induce sleep and to alleviate pain. Pharmacopoeia. Book describing drugs and their preparation or a collection or stock of drugs. Pluralistic. Society where there are several distinct ethnic, religious, or cultural groups that coexist with one another. Septicemia. Invasion of pathogenic bacteria into the bloodstream. Trephination. Removal of a circular piece of bone, especially of the skull, by a trephine. Typhus. Acute infectious disease that causes severe headache, rash, high fever, and progressive neurologic involvement, prevalent where conditions are unsanitary and congested. Yellow fever. Acute infectious disease where a person develops jaundice, vomits, hemorrhages, and has a fever caused by mosquitoes. ACCSCT. Accrediting Commission of Career Schools and Colleges of Technology accredits at the institutional level. ASICS. Accrediting Council for Independent Colleges and Schools accredits at the institutional level. COIP. Commission on Accreditation for Allied Health Education Programs accredits at the program level, specifically accredit medical assistants. ABS. Accrediting Bureau of Health Education Schools also grants accreditation of medical assisting programs. Standards are the minimum standards of quality used in accrediting programs that prepare individuals to enter the medical assisting profession. Allergy and Immunology Specialty. Allergist and immunologist evaluates diseases, disorders of the immune system, and problems related to asthma and allergy. Cardiology Specialty. Cardiologist evaluates and treats medical conditions of the heart. Dermatology Specialty. Dermatologist evaluates disorders, diseases of skin, hair, nails, and related tissues. Emergency Medicine Specialty. Emergency medical doctor evaluates and treats medical conditions that result from trauma or sudden illness, manages emergency department. Family Practice Specialty. Family practitioner treats the whole family from infancy to death. Internal Medicine Specialty. Internist provides comprehensive care, practices preventive care, treats long-term and chronic conditions. Obstetrics and Gynecology Specialty. Obstetrician and gynecologist provides care to pregnant women, delivers babies, treats disorders, diseases of reproductive system. Ophthalmology Specialty. Ophthalmologist provides comprehensive care of the eye and its structures and offers vision services. Orthopedic Surgeon Specialty. Orthopedist examines, diagnoses, and treats diseases and injuries of the musculoskeletal system. Otolaryngology Specialty. Otolaryngologist treats diseases, disorders of the ears, nose, and throat. Pediatric Specialty. Pediatrician treats diseases, disorders of children and adolescents, monitors growth and development of children. Psychiatry and Neurology Specialty. Psychiatrist and neurologist diagnoses and treats patients with mental, emotional, or behavioral disorders. General Surgery Specialty. Surgeon operates to repair or remove diseased or injured part of the body. Colon and Rectal Surgical Specialty. Colorectal surgeon operates to remove or repair diseased colon and rectal areas of the body. Neurological Surgical Specialty. Neurosurgeon treats condition of the nervous systems, often through surgery. Plastic Surgical Specialty. Plastic surgeon repairs and reconstructs physical defects, provides cosmetic enhancements. Thoracic Surgical Specialty. Thoracic surgeon performs surgery on the respiratory system, chest, heart, and cardiovascular system. Radiology Specialty. Radiologist interprets diagnostic images, performs special procedures, manages radiological services. Urology Specialty. Urologist treats diseases, disorders of the urinary tract. Acupressure. A massage that applies pressure to specific acupuncture-like points in the body. Pressure encourages the flow of vital energy along the meridian pathways. It is used to control chronic pain, migraine headaches, and backaches. Aromatherapy. The inhalation and bodily application of essential oils from aromatic plants to relax, balance, rejuvenate, restore, or enhance the body's mind and spirit. It strengthens the self-healing process by indirect stimulation of the immune system. Biofeedback. Biofeedback machines gauge internal bodily functions and help patients tune into these functions and identify the triggers that evoke symptoms. Relaxation can be taught to relieve the symptoms. Guided imagery. Uses images or symbols to train them and create a definitive physiological or psychological effect, relieves stress and anxiety and reduces pain. Hydrotherapy. Hydrotherapy uses the buoyancy, warmth, and effects of water and its turbulence to speed recovery after surgery and to reduce pain and stress, spasm and discomfort. It is especially beneficial for work or sports-related injuries and arthritis. Hypnotherapy. Massage. Massage reduces stress, manages chronic pain, promotes relaxation, and increases circulation of the blood and lymph. Hand stroking on the body helps patients become more familiar with their pain. Anesthesiologist assistant. Performs preoperative tasks, performs airway management and drug administration for induction and maintenance of anesthesia during surgery under direction of a licensed and qualified anesthesiologist. Athletic trainer. Provides a variety of services including injury prevention, recognition, immediate care, treatment, and rehabilitation after athletic trauma. Clinical Laboratory Technician Associate Degree. Performs all routine tests in a medical laboratory and is able to discriminate and recognize factors that directly affect procedures and results. Works under direction of pathologist, provider medical technologist, or scientist. Diagnostic Medical Sonographer. Provides patient services using medical ultrasound under the supervision of a provider. Electroneurodiagnostic Technologist. Possesses the knowledge, attributes, and skills to obtain interpretable recordings of a patient's nervous system functions. Emergency Medical Technician Paramedic. Recognizes, assesses, and manages medical emergencies of acutely ill or injured patients in pre-hospital care settings, working under the direction of a provider. Medical Assistant. Functions under the supervision of licensed medical professionals and is competent in both administrative office and clinical laboratory procedures. Medical Illustrator. Creates visual material designed to facilitate the recording and dissemination of medical, biological, and related knowledge through communication media. Occupational Therapist. Ophthalmic Medical Technician or Technologist. Assists ophthalmologists to perform diagnostic and therapeutic procedures. Personal Fitness Trainer. Develops activity plans for each individual that integrates a complete approach to fitness and wellness through exercise, strength training, and proper diet. Radiographer. Provides patient services using imaging modalities as directed by providers qualified to order and perform radiologic procedures. Registered Health Information Administrator. Manages health information systems consistent with the medical, administrative, ethical, and legal requirements of the healthcare delivery system. Registered Health Information Technician. Possesses the technical knowledge and skills necessary to process, maintain, compile, and report patient data. Respiratory Therapist. Applies scientific knowledge and theory to practical clinical problems of respiratory care. Surgical Technologist. Works as an integral member of the surgical team, which includes surgeons, anesthesiologists, registered nurses, and other surgical personnel delivering patient care and assuming appropriate responsibilities before, during, and after surgery. Moses. Advocate of health rules in Hebrew religion. 1000 BC. Beginnings of ancient Chinese medicine. Hippocrates. Greek physician, father of medicine. Chang Cheng. Chinese physician called the Hippocrates of China. 1368 to 1644. Chinese medicine reaches its peak. Andreas Vesalius, Brussels physician, wrote first anatomical studies. Anton van Leeuwenhoek, Dutch lens grinder, discovered lens magnification. John Hunter, founder of scientific surgery. Edward Jenner, developed smallpox vaccine. Ian Laennec, invented the stethoscope. Samuel Hahnemann, German physician, established homeopathy. Ignaz Semmelweis, introduced hand washing to prevent childbed fever. W.T.G. Morton, U.S. physician, introduced ether as anesthetic. Louis Pasteur, father of bacteriology. Florence Nightingale, founder of modern nursing. Elizabeth Blackwell, first female physician in the U.S. Clara Barton, started the American Red Cross in 1881. Joseph Lister, laid the groundwork on asepsis. Andrew Taylor, established the first school of osteopathy in 1892. Daniel David Palmer, founded chiropractic profession in Iowa in 1895. Elizabeth G. Anderson, first female physician in Great Britain. Frederick G. Banting, isolated and injected insulin for diabetes treatment in 1922. 1903. First electrocardiogram machine invented. Robert Koch, bacteriologist, developed culture plate method. Wilhelm Röntgen, discovered X-rays. George Papanicolaou, discovered cancer cells in 1928. Sir Alexander Fleming, discovered penicillin in 1928. Albert Schatz, discovered streptomycin in 1943, cure for tuberculosis. 1945. Penicillin brought into production. Pausal, created the first heart pacemaker in 1952. C. Walton Lilly, performed first successful open heart surgery in 1952. John Gibbon, first heart-lung machine used for surgery. Joseph Murray, performed first person-to-person kidney transplant in 1954. Christian Barnard, performed first human heart transplant in 1967. Ian Wilmette, cloned a Fedora chip called Ali in 1996. 1953. Three-dimensional structure of DNA discovered. First human heart-lung bypass machine used on human. 1950 to 1960. Vaccines against polio, measles, and rubella developed. 1978. First baby born from in vitro fertilization. The profession of medical assisting was formally recognized by the U.S. Department of Education. 1982. Hepatitis B vaccine available. 1990 to 2000. Human genome map created by team of scientists. 1991. Women's Health Initiative begins 15-year research on cardiovascular disease, cancer, and osteoporosis. Board of Trustees of the OMA approved the current definition of medical assisting. 1995. Varicella and hepatitis A vaccines available. 2005. Combination vaccine for measles, mumps, rubella, and varicella available. 2006. Vaccine for adult shingles approved. 2007. Current definition of medical assisting. Medical assisting is an allied health profession whose practitioners function as members of the healthcare delivery team and perform administrative and clinical procedures. Formal education takes place in community and junior colleges as well as in proprietary schools. DACUM, developing a curriculum analysis. Occupational analysis of the CMA, also known as Medical Assistant All Delineation Chart, in 1997, in coordination with the National Board of Medical Examiners, Educators, and Practicing CMAs, the AMA developed the Medical Assistant Role Delineation Chart. Practicum, externship, and internship. All terms used to define the transition period between the classroom and actual employment. Practicum is planned and supervised by a coordinator from the medical assisting program and the healthcare facility that agrees to become a partner in the education and employability of the student. Practicum side expectation. Professional in appearance and demeanor, punctual, willing to learn, open to criticism, accepting of assignments, helpful to coworkers, working to the best of their ability, mindful of patient confidentiality. Practicum site no-nos. Consider asking for or taking medication samples without permission, feel entitled to any special treatment, anticipate free treatment for self, family, or friends, expect to be paid. Benefits of practicum. ACCSCT, Accrediting Commission of Career Schools and Colleges of Technology. ASICS, Accrediting Council for Independent Colleges and Schools. COIP. Standards are the minimum standards of quality used in accrediting programs that prepare individuals to enter the medical assisting profession. ABES is recognized by the United States Department of Education as an accrediting agency of public and private schools and colleges that primarily offer health education, also recognized by the AMA, AMT, NLNA, NBSTSA. Empathy. Stepping into the patient's place, discovering what the patient is experiencing, and then recognizing and identifying with those feelings. Treat patients as you want to be treated. Attributes of a medical assistant. Empathy, attitude, dependability, initiative, flexibility, desire to learn, appearance, ability to communicate, ethical behavior. AMA policy. CMA. Certification is voluntary, not mandatory, for medical assistants to practice. The examination measures professional knowledge at job entry level. 1972. The AMT established the certification examination for medical assistants. The designation of RME is conferred on those individuals who successfully pass the examination. RMA is a voluntary credential for the profession of medical assisting. The credentials are national, and examinations are given throughout the U.S. in both computerized and paper and pencil format. AMT, American Medical Technologists, founded in 1939, is a national certification. RMA certification examination includes general medical assisting topics, medical terminology, clinical medical assisting, medical law and ethics, human relations, administrative medical assisting, pharmacology, therapeutic modalities, laboratory procedures, electrocardiography, and first aid. MAS, Medical Administrative Specialist. CMAS, Certified Medical Administrative Specialist. CCP, Certification Continuation Program. AMT, American Medical Technologists Institute for Education. NHA, National Healthcare Association. CARE, Consistency, accuracy, responsibility, and excellence in medical imaging and radiation therapy. AMT, the designation CMAS is awarded by this group. Maxine Williams, the first president of the AMA organization. Doctor of Medicine. A doctorate degree in medicine and a license to practice allows a person to diagnose and treat medical conditions. Attends 4 years of medical school after receiving a bachelor's degree. Role of the MA. Receptionist, secretary, office manager, bookkeeper, insurance coder and biller, sometimes transcriptionist, patient educator, and clinical assistant. HUC. Health Unit Coordinator, perform non-clinical patient care tasks for the nursing unit of a hospital. RD. Registered Dietitian. RN. Registered Nurse. NCLEX-RN. National Council Licensure Examination. LPN. Licensed Practical Nurse. NP. Nurse Practitioner. ARNP. Advanced Registered Nurse Practitioner. PA. Physician Assistant. NCCPA. National Commission on Certification of Physician Assistants. PANS. Physician Assistant National Certifying Examination. 5 methods of treatment to bring a person back to the right track. 1. Cure the spirit. 2. Nourish the body. 3. Give medications. 4. Treat the whole body. 5. Use acupuncture and moxibustion. Specialists. Varied names. Witch doctors, medicine men and women, shamans or healing priests and physicians. Soma. A mythical drug reported in India's religious literature as a mind-altering drug. Yagent peyote. Used to induce trance-like experiences in the primitive tribes of Central, South, and North America. Saint Benedict of Nursia. Forbade the study of medicine. Michelangelo. Spent years on careful human dissection, and this anatomical detail is evident in his paintings in the Sistine Chapel in the Vatican in Rome. Leonardo da Vinci. Made anatomical preparations from which he produced drawings representing the skeletal, muscular, nervous, and vascular systems. His accurate sketch of the spinal vertebrae went undiscovered for more than 100 years. Edward Jenner. Made a great contribution to the prevention of disease by discovering a method of vaccination against smallpox. Ignaz Philipp Semmelweis. The Hungarian physician and obstetrician was able to prove that physicians who came from an autopsy directly to the care of postpartum women without scrubbing their hands and washing instruments carried infection with them. Louis Pasteur. Sometimes referred to as the father of preventive medicine as a result of bacteria and infectious disease. Joseph Lister. Revolutionized surgery because of his belief in Pasteur's theory of using carbolic acid as an antiseptic spray. He insisted that all instruments and physicians' hands be washed with the solution. Robert Koch. Used the culture plate method for isolating bacteria and demonstrated how cholera was transmitted by food and water. His discovery changed the way health departments cared for persons with infectious disease. Frederick G. Banting and a medical student, Charles Best, were able to isolate and inject insulin into a 14-year-old boy who was dying of diabetes. George Papanicolaou discovered cancer cells in 1928. Alexander Fleming discovered penicillin. Howard Florey and Ernst Chain. First development of penicillin. C. Walton Lillehei. Performed the first successful open-heart surgery in 1952. Dr. Christian Barnard. Performed the first human heart transplant in 1967. Paralytic poliomyelitis. A virus spread through the fecal-oral route multiplies in the intestine and invades the nervous system, often referred to as infantile paralysis, mostly affects children under the age of 5 years, and there is no cure. Bulbar polio. A poliomyelitis that affected nerve cells in the medulla oblongata, or the lowest portion of the brainstem responsible for regulating heart rate, breathing, and blood pressure, were placed in iron lungs. Iron lungs worked by creating an airtight seal around individuals placed on their backs so that only their heads were visible. A pump alternately raised and lowered the air pressure inside to fill and deflate the lungs, forcing the body to simulate breathing. President Franklin D. Roosevelt, diagnosed with polio in 1921, waged war on the disease, founded the National Foundation for Infantile Paralysis, which later became known as the March of Dimes. Dr. Jonas Salk developed the first polio vaccine in 1952. Dr. Albert Sabin developed an oral polio vaccine in 1961. 1979. The last case of polio in the U.S. was reported. WHO, World Health Organization, UNICEF, United Nations International Children's Emergency Fund. Kaposi sarcoma. A rare cancer outbreak was seen in young gay men in New York and California in 1981. MRSA. Methicillin-resistant Staphylococcus aureus, a new type of bacteria that is especially dangerous to individuals with weakened immune systems, can come from medical facilities or be community-based. Hippocrates. Hippocratic Oath, which established guidelines for a physician's practice of medicine. Elizabeth Blackwell, the first female physician in the U.S. who was awarded her degree in 1849. VCT. Volume computed tomography. The system can perform a whole-body trauma scan in less than 10 seconds. PillCam ESO. A smooth plastic capsule with a tiny camera at each end is able to take as many as 2,600 pictures of the esophagus in less than 20 minutes. Bone. A form of connective tissue that is the second hardest tissue in the human body. Periosteum. Tough, fibrous tissue that forms the outermost covering of bone. Compact bone. Dense, hard, and very strong bone that forms the protective outer layer of bones. Spongy bone. Lighter, weaker bone that is commonly found in the ends and inner portions of long bones. Medullary cavity. Located in the shaft of a long bone and surrounded by compact bone. Medullary. Pertaining to the inner section. Endosteum. Tissue that lines the medullary cavity. Red bone marrow. Hemopoietic tissue located within the spongy bone that manufactures red blood cells, hemoglobin, white blood cells, and thrombocytes. Hemopoietic. Pertaining to the formation of blood cells. Hematopoietic. Another way to spell hematopoietic. Yellow bone marrow. Located in the medullary cavity and composed chiefly of fat cells, functions as a fat storage area. Cartilage. Smooth rubbery blue-white connective tissue that acts as a shock absorber between bones. Articular cartilage. Covers the surfaces of bones where they come together to form joints. Meniscus. Curved fibrous cartilage found in some joints. Diaphysis. Shaft of a long bone. Epiphysis. Wide end of a long bone which is covered with articular cartilage. Proximal epiphysis. End of the bone located nearest the midline. Distal epiphysis. End of the bone located farthest away from the midline. Foramen. Opening in a bone through which blood vessels, nerves, and ligaments pass. Foramen magnum. Opening in the occipital bone through which the spinal cord passes. Process. Normal projection on the surface of a bone that serves as an attachment for muscles and tendons, structure that extends out from a cell body. Mastoid process. The bony projection located on temporal bones just behind the ears. Joint. Place of union between two or more bones. Articulations. Another term for joints. Fibrous joints. Consist of inflexible layers of dense connective tissue and hold bones together. Sutures. Another term for fibrous joints. Fontanelles. Flexible soft spots on the skull of a newborn. Soft spots. Common term for fontanelles. Cartilaginous joints. Consist of bones connected entirely by cartilage allowing only slight movement. Pubic symphysis. Cartilaginous joint located between the pubic bones in the anterior of the pelvis that allows some movement to facilitate childbirth. Synovial joint. Joint where two bones articulate to permit a variety of motions. Articulate. Come together. Ball and socket joints. Synovial joints that allow a wide range of movement in many directions. Hinge joints. Synovial joints that allow movement primarily in one direction or plane. Synovial capsule. Outermost layer of strong fibrous tissue that resembles a sleeve as it surrounds the joint. Synovial membrane. Lines the synovial capsule and secrete synovial fluid. Synovial fluid. Flows within the synovial cavity and acts as a lubricant to make smooth movement possible. Ligaments. Bands of fibrous tissue that form joints by connecting one bone to another or joining a bone to cartilage. Bursa. A fibrous sac that acts as a cushion to ease movement in areas subject to friction such as where a tendon passes over a bone. Axial skeleton. Protects the major organs of the nervous, respiratory, and circulatory systems. Axial. Pertaining to an axis. Appendicular skeleton. Makes body movement possible and protects the organs of digestion, excretion, and reproduction. Appendicular. Referring to an appendage. Appendage. Anything that is attached to a major part of the body. Upper extremities. Shoulders, arms, forearms, wrists, and hands. Lower extremities. Hips, thighs, legs, ankles, and feet. Cranium. The portion of the skull that encloses the brain. Frontal bone. Forms the forehead. Parietal bones. Form most of the roof and upper sides of the cranium. Occipital bone. Forms the posterior floor and walls of the cranium. Temporal bones. Form the sides and base of the cranium. Sphenoid bone. Forms part of the base of the skull and parts of the floor and sides of the orbit. Orbit. Bony socket that surrounds and protects the eyeball. Ethmoid bone. Forms part of the posterior portion of the nose, the orbit, and the floor of the cranium. Auditory ossicles. Bones of the middle ear. External auditory meatus. Opening of the external auditory canal of the outer ear located in the temporal bone on each side of the skull. Meatus. External opening of a canal. Nasal bones. Form the upper part of the bridge of the nose. Zygomatic bones. Articulate with the frontal bone. Cheekbones. Common name for zygomatic bones. Maxillary bones. Form most of the upper jaw. Maxillae. Another term for maxillary bones. Palatine bones. Form part of the hard palate of the mouth and the floor of the nose. Lacrimal bones. Make up part of the orbit at the inner angle of the eye. Inferior conchae. Thin scroll-like bones that form part of the interior of the nose. Vomer bone. Forms the base for the nasal septum. Nasal septum. Cartilage wall that divides the two nasal cavities. Mandible. Only movable bone of the skull. Jawbone. Common name for mandible. Temporomandibular joint. Attaches the mandible to the skull. TMJ. Another term for temporomandibular joint. Thoracic cavity. Bony structure that protects the heart and lungs. Ribcage. Common term for thoracic cavity. Ribs. Bones that attach posteriorly to the thoracic vertebrae. Costals. Another term for ribs. True ribs. First 7 pairs of ribs are attached anteriorly to the sternum. False ribs. Central 3 pairs of ribs attached anteriorly to cartilage that joins with the sternum. Floating ribs. Last 2 pairs of ribs that are only attached posteriorly. Sternum. Forms the middle of the front of the ribcage. Manubrium. Bony structure that forms the upper portion of the sternum. Body of the sternum. Bony structure that forms the middle portion of the sternum. Xiphoid process. structure made of cartilage that forms the lower portion of the sternum. Pectoral girdle, formed by the shoulders, supports the arms and hands. Shoulder girdle, another term for pectoral girdle. Girdle, structure that encircles the body. Clavicle, slender bone that connects the manubrium of the sternum to the scapula. Collarbone, common term for clavicle. Scapula, medical term for shoulder blade. Shoulder blade, common term for scapula. Acromion, extension of the scapula that forms the high point of the shoulder. Humerus, bone of the upper arm. Radius, smaller and shorter bone of the forearm, runs up the thumb side of the forearm. Ulna, larger and longer bone of the forearm. Olecranon process, large projection on the upper end of the ulna that tingles when struck. Funny bone, common term for olecranon process. Carpals, the 8 bones that form the wrist. Metacarpals, the 5 bones that form the palms of the hand. Phalanges, the 14 bones of the fingers. Spinal column, supports the head and body and protects the spinal cord. Vertebral column, another term for spinal cord. Vertebra, a single segment of the spinal column. Vertebral, pertaining to the vertebrae. Vertebrae, bony structure units of the spinal column. Body of the vertebra, solid anterior portion of a vertebra. Lamina, the posterior portion of a vertebra. Vertebral foramen, the opening in the middle of the vertebra that the spinal cord passes through. Cervical vertebrae, the first set of 7 vertebrae that form the neck. C1 through C7, numerical term for the cervical vertebrae. Cervical, pertaining to the neck. Thoracic vertebrae, the second set of 12 vertebrae that form the outward curve of the spine. T1 through T12, numerical term for the thoracic vertebrae. Thoracic, pertaining to the thoracic cavity. Lumbar vertebrae, the third set of 5 vertebrae that form the inward curve of the lower spine. L1 through L5, the numeric term for the lumbar vertebrae. Lumbar, relating to the lower back. Sacrum, slightly curved, triangular-shaped bone near the base of the spine that forms the lower portion of the back. Coccyx, forms the end of the spine and is made up of 4 small vertebrae that are fused together. Tailbone, common term for coccyx. Intervertebral discs, made of cartilage and separate and cushion the vertebrae from each other. Pelvic girdle, protects the internal organs and supports the lower extremities. Pelvis or hips, common terms for pelvic girdle. Ilium, broad blade-shaped bone that forms the back and sides of the pubic bone. Sacroiliac, slightly movable articulation between the sacrum and posterior portion of the ilium. Ischium, forms the lower posterior portion of the pubic bone. Pubis, located just below the urinary bladder and forms the anterior portion of the pubic bone. Pubic bones, formed from the fusion of the ilium, ischium and pubis. Pubic symphysis, holds the left and right pubic bones together. Acetabulum, large circular cavity in each side of the pelvis that articulates with the head of the femur. Hip socket, common term for acetabulum. Femur, the upper leg bone. Thigh bone, another term for femur. Head of the femur, articulates with the acetabulum. Femoral neck, the narrow area just below the head of the femur. Femoral, pertaining to the femur. Knees. Complex joints that make possible movement between the upper and lower leg. Patella. Bony anterior portion of the knee. Kneecap. Common term for patella. Popliteal. Posterior space behind the knee where ligaments, vessels, and muscles are located. Cruciate ligaments. Make possible the movements of the knee. Tibia. Larger weight-bearing bone in the anterior of the lower leg. Fibula. Smaller of the two bones in the lower leg. Malleolus. Rounded bony protuberance on each side of the ankle. Ankles. Form the joint between the lower leg and the foot. Talus. The ankle bone that articulates with the tibia and fibula. Calcaneus. The largest of the tarsal bones. Heel bone. Common term for calcaneus. Metatarsals. Form the part of the foot to which the toes are attached. Phalanges. The bones of the toes. Chiropractor. Specializes in the manipulative treatment of disorders originating from misalignment of the spine. Manipulative treatment involves manually adjusting the positions of the bones. Orthopedic surgeon. A physician who specializes in diagnosing and treating diseases and disorders involving the bones, joints, and muscles. Orthopedist. Another term for orthopedic surgeon. Osteopath. Uses traditional forms of medical treatment in addition to specializing in treating health problems by spinal manipulation. Osteopathy. Medical practice specializing in treating health problems by spinal manipulation in addition to traditional forms of medical treatment also means any bone dysesthesia. Podiatrist. Specializes in diagnosing and treating disorders of the foot. Ankylosis. Loss or absence of mobility in a joint due to disease, injury, or a surgical procedure. Mobility. Capacity for movement. Arthrosclerosis. Stiffness of the joints, especially in the elderly. Bursitis. Inflammation of a bursa. Chondromalacia. Abnormal softening of cartilage. Chondroma. Slow-growing benign tumor derived from cartilage cells. Costochondritis. Inflammation of the cartilage that connects the rib to the sternum. Hallux valgus. Abnormal enlargement of the joint at the base of the great toe. Bunion. Common term for hallux valgus. Hallux. Big toe. Valgus. Bend. Hemarthrosis. Blood within a joint. Synovitis. Inflammation of the synovial membrane that results in swelling and pain of the affected joint. Dislocation. Total displacement of a bone from its joint. Luxation. Another term for dislocation. Subluxation. Partial displacement of a bone from its joint. Arthritis. Inflammatory condition of one or more joints. Rheumatism. Obsolete term for arthritis to describe any painful disorder of the joints. Osteoarthritis. A degenerative joint disease characterized by the wearing away of the articular cartilage. Wear and tear arthritis. Another term for osteoarthritis. Degenerative joint disease. Characterized by the wearing away of the articular cartilage within the joints. Degenerative. Breaking down or impairment of a body part. Spondylosis. Degenerative disorder that can cause loss of normal spinal structure and function. Gouty arthritis. Type of arthritis characterized by deposits of uric acid in the joints. Gout. Another term for gouty arthritis. Uric acid. Byproduct that is normally excreted by the kidneys. Rheumatoid arthritis. chronic autoimmune disorder in which the joints and some organs of other body systems are attacked. Autoimmune disorders. Diseases in which the immune system produces antibodies against its own tissues. Ankylosing spondylitis. Form of rheumatoid arthritis that primarily causes inflammation of the joints between the vertebrae. Ankylosing. Progressive stiffening of a joint or joints. Spondylitis. Inflammation of the vertebrae. Juvenile rheumatoid arthritis. An autoimmune disorder that affects children 16 or younger with symptoms that include stiffness, pain, joint swelling, skin rash, fever, slow growth, and fatigue. Herniated disc. Breaking apart of an intervertebral disc that results in pressure on spinal nerve roots. Slip disc or ruptured disc. Common terms for herniated disc. Lumbago. Pain of the lumbar region of the spine. Low back pain. Common term for lumbago. Spondylolisthesis. Forward slipping movement of the body on one of the lower lumbar vertebrae on the vertebra or sacrum below it. Spina bifida. Congenital defect that occurs during early pregnancy when the spinal canal fails to close completely around the spinal cord. Spinal. Pertaining to the spine. Bifida. Split. Kyphosis. Abnormal increase in the outward curvature of the thoracic spine as viewed from the side. Humpback or Dowger's hump. Common terms for kyphosis. Lordosis. Abnormal increase in the forward curvature of the lumbar spine. Swayback. Common term for lordosis. Scoliosis. Abnormal lateral curvature of the spine. Cranostenosis. Malformation of the skull due to the premature closure of the cranial sutures. Fibrous dysplasia. Bone disorder that destroys normal bone structure and replaces it with fibrous tissue. Ostealgia. Pain in a bone. Osteodynia. Another term for ostealgia. Osteitis. Inflammation of bone. Osteitis. Alternative spelling for osteitis. Osteomalacia. Abnormal softening of bones in adults. Adult rickets. Another term for osteomalacia. Osteomyelitis. Inflammation of the bone marrow and adjacent bone. Osteonecrosis. Death of bone tissue due to insufficient blood supply. Paget's disease. Bone disease characterized by the excessive breakdown of bone tissue followed by abnormal bone formation. Osteitis deformans. Another term for Paget's disease. Rickets. Bone disease occurring in children which results from a deficiency of vitamin D. Infantile osteomalacia. Another term for rickets. Short stature. Condition resulting from the failure of the bones of the limbs to grow to an appropriate length. Dwarfism. Former term for short stature. Little people. Term referring to individuals affected by short stature. Talipes. Any congenital deformity of the foot involving the talus. Clubfoot. Common term for talipes. Primary bone cancer. Relatively rare malignant tumor that originates in a bone. Malignant. Becoming progressively worse and life-threatening. Ewing's sarcoma. A tumor that occurs in the bones of the upper arm, legs, pelvis, or rib. Secondary bone cancer. Tumors that have metastasized to bones from other organs. Metastasized. Spread. Myeloma. Cancer that occurs in blood-making cells found in the red bone marrow. Osteochondroma. Benign bony projection covered with cartilage. Benign. Not life-threatening and does not recur. Exostosis. Another term for osteochondroma. Osteoporosis. Marked loss of bone density and increase in bone porosity frequently associated with aging. Osteopenia. Thinner than average bone density in a young person. Compression fracture. Occurs when the bone is pressed together on itself. Vertebral crush fracture. Another term for compression fracture. Coles fracture. Fracture at the lower end of the radius when a person tries to stop a fall by landing on the hand. Fractured wrist. Another term for Coles fracture. Osteoporotic hip fracture. Caused by weakening of the bones due to osteoporosis, can occur either spontaneously or as the result of a fall. Broken hip. Common term for osteoporotic hip fracture. Osteoporotic. Pertaining to or caused by the porous condition of bones. Fracture. A broken bone. Closed fracture. Fracture in which the bone is broken but there is no open wound in the skin. Simple fracture or complete fracture. Other terms for a closed fracture. Open fracture. Fracture in which the bone is broken and there is an open wound in the skin. Compound fracture. Another term for open fracture. Comminuted fracture. Fracture in which the bone is splintered or crushed. Comminuted. Crushed into small pieces. Green stick fracture. Fracture in which the bone is bent and only partially broken. Incomplete fracture. Another term for green stick fracture. Oblique fracture. Fracture which occurs at an angle across the bone. Pathologic fracture. Fracture which occurs when a weakened bone breaks under normal strain. Spiral fracture. Fracture in which the bone has been twisted apart. Stress fracture. Small crack in the bone that often develops from chronic impact. Transverse fracture. Fracture which occurs straight across the bone. Fat embolus. Can form when a long bone is fractured and fat cells from yellow bone marrow are released into the blood. Embolus. Any foreign matter circulating in the blood that can become lodged and block a blood vessel. Crepitation. Grating sound heard when the ends of a broken bone move together. Crepitus. Another term for crepitation. Callus. Bulging deposit around the area of a break that eventually becomes bone. Radiograph. Use of X-radiation to visualize bone fractures and other abnormalities. Arthroscopy. Visual examination of the internal structure of the joint. Arthroscope. Used to perform arthroscopy. Bone marrow biopsy. Diagnostic test that may be necessary after abnormal types or numbers of red or white blood cells are found in a complete blood count test. Bone marrow aspiration. Use of a syringe to withdraw the liquid bone marrow. Magnetic resonance imaging. Used to image soft tissue structures such as the interior of complex joints. Bone scan. A form of nuclear medicine used in diagnostic procedures of the skeletal system. Bone density testing. Used to determine losses or changes in bone density. Ultrasonic bone density test. Screening test for osteoporosis or other conditions that cause a loss of bone mass which uses sound waves to take measurements of the calcaneus bone. Dual X-ray absorptiometry. Low-exposure radiographic measurement of the spine and hips to measure bone density. Bone marrow transplant. Used to treat bone marrow cancers. Cancer cells and bone marrow are destroyed, then healthy bone marrow stem cells are transfused into the recipient's blood. Allogenic bone marrow transplant. Bone marrow transplant using healthy bone marrow cells from a compatible donor. Allogenic. Originating within another. Autologous bone marrow transplant. Bone marrow transplant in which the patient receives his own bone marrow cells. Autologous. Originating within an individual. Orthotic. Mechanical appliance specially designed to control, correct, or compensate for impaired limb function. Prosthesis. Substitute for a diseased or missing body part. Arthritis. Surgical fusion of two bones to stiffen a joint. Surgical ankylosis. Another term for arthritis. Arthrolysis. Surgical loosening of an ankylosed joint. Arthroscopic surgery. Minimally invasive procedure for the treatment of the interior of a joint. Bursectomy. Surgical removal of a bursa. Chondroplasty. Surgical repair of damaged cartilage. Synovectomy. Surgical removal of a synovial membrane from a joint. Arthroplasty. Surgical placement of an artificial joint. Implant. Joint replacement prosthesis. Total knee replacement. Procedure in which all of the parts of the knee are replaced. Total knee arthroplasty. Another term for total knee replacement. Partial knee replacement. Procedure in which only part of the knee is replaced. Total hip replacement. Procedure performed to restore a damaged hip to full function. Total hip arthroplasty. Another term for total hip replacement. Bone-conserving hip resurfacing. An alternative to removing the head of the femur during hip arthroplasty. Revision surgery. Replacement of a worn or failed implant. Percutaneous discectomy. Procedure used to treat a herniated intervertebral disc that sucks out or vaporizes the disc. Percutaneous. Performed through the skin. Percutaneous vertebroplasty. Procedure used to treat osteoporosis-related compression fractures which injects bone cement. Laminectomy. Surgical removal of the posterior portion of a vertebra. Spinal fusion. Technique to immobilize part of the spine by jointing together two or more vertebrae. Fusion. Join together. Craniectomy. Surgical removal of a portion of the skull. Intracranial pressure. Amount of pressure inside the skull. Craniotomy. Surgical incision or opening into the skull. Cranioplasty. Surgical repair of the skull. Osteoclasis. Surgical fracture of the bone to correct a deformity. Ostectomy. Surgical removal of bone. Osteoplasty. Surgical repair of a bone or bones. Osteopathy. Surgical suturing or wiring together of bones. Osteotomy. Surgical incision or sectioning of a bone. Periosteotomy. Incision through the periosteum to the bone. Closed reduction. Attempted realignment of the bone involved in a fracture or joint dislocation. Manipulation. Another term for closed reduction. Open reduction. Surgical procedure required to realign fractured bone parts when manipulation is not practical. Immobilization. Holding, suturing, or fastening a bone in a fixed position with strapping or a cast. Stabilization. Another term for immobilization. Traction. Pulling force exerted on a limb in a distal direction in an effort to return the bone or joint to normal alignment. External fixation. Fracture treatment procedure in which pins are placed through the soft tissues and bone so that an external appliance can be used to hold the pieces of bone firmly in place during healing. Internal fixation. A fracture treatment procedure in which a plate or pins are placed directly into the bone to hold the broken pieces in place. The fixation is not usually removed after the fracture has healed. Open reduction. Another term for internal fixation. Muscle fibers. Long, slender cells that make up muscles. Fascia. Sheet of fibrous connective tissue that covers, supports, and separates muscles or groups of muscles. Myofascial. Pertaining to muscle tissue and fascia. Tendon. A narrow band of non-elastic, dense, fibrous connective tissue that attaches a muscle to a bone. Ligaments. Connect one bone to another. Achilles tendon. Attaches the gastrocnemius muscle to the heel bone. Gastrocnemius. Major muscle of the calf of the leg. Aponeurosis. Sheet-like fibrous connective tissue that resembles a flattened tendon that serves as a fascia to bind muscles together or as a means of connecting muscle to bone. Skeletal muscles. Attach to the bones of the skeleton and make body motions possible. Voluntary muscles or striated muscles. Other terms for skeletal muscles. Striated. Striped. Smooth muscles. Located in the walls of internal organs, they move and control the flow of fluids through these structures. Myocardial muscles. Form the muscular walls of the heart. Myocardium or cardiac muscle. Other terms for myocardial muscles. Muscle innervation. The stimulation of a muscle by an impulse transmitted by a motor nerve. Motor nerves. Enable the brain to stimulate a muscle to contract. Neuromuscular. Pertaining to the relationship between nerve and muscle. Antagonistic muscle pairs. How all muscles are arranged. Antagonistic. Refers to working in opposition to each other. Contraction. The tightening of a muscle. Relaxation. Occurs when a muscle returns to its original form. Abduction. Movement of a limb away from the midline of the body. Abductor. Muscle that moves a part away from the midline. Adduction. Movement of a limb toward the midline of the body. Adductor. Muscle that moves a part toward the midline. Flexion. Decreasing the angle between two bones by bending a limb at a joint. Flexor. Muscle that bends a limb at a joint. Extension. Increasing the angle between two bones or the straightening of a limb. Extensor. Muscle that straightens a limb at a joint. Hyperextension. The extreme or overextension of a limb or body part beyond its normal limit. Elevation. Raising or lifting a body part. Levator. Muscle that raises a body part. Depression. Lowering a body part. Depressor. Muscle that lowers a body part. Rotation. Circular movement around an axis. Axis. An imaginary line that runs lengthwise through the center of the body. Circumduction. Circular movement of a limb at the far end. Rotator muscle. Turns a body part on its axis. Rotator cuff. Group of muscles and their tendons that hold the head of the humerus securely in place as it rotates within the shoulder joint. Supination. Act of rotating the arm or the leg so that the palm of the hand or sole of the foot is turned forward and upward. Pronation. Act of rotating the arm or leg so that the palm of the hand or sole of the foot is turned downward or backward. Dorsiflexion. Movement that bends the foot upward at the ankle. Plantar flexion. Movement that bends the foot downward at the ankle. Plantar. Pertaining to the sole of the foot. Levator anguli-oris. Raises the corner of the mouth in a smile. Depressor anguli-oris. Lowers the corner of the mouth in a frown. Origin. Less movable attachment where the muscle begins and located nearest the midline or on a less movable part of the skeleton. Insertion. More movable attachment where the muscle ends by attaching to a bone or tendon, usually the end farthest from the midline. Sternocleidomastoid muscle. Muscle with an origin near the midline at the sternum and the clavicle and an insertion into the mastoid process. Flexor carpi muscle. Muscle that makes bending the wrist possible. Extensor carpi muscle. Muscle that makes straightening the wrist possible. Carpi. Wrist or wrist bones. Pectoralis major. A thick fan-shaped muscle on the anterior chest wall. Pectoral. Relating to the chest. Lateralis. Toward the side. Medialis. Toward the midline. Vastus lateralis and vastus medialis. Muscles that flex and extend the leg at the knee. External or superficial. Terms meaning near the surface. Internal. Deeper location. External oblique and internal oblique. Flex and rotate the spinal column and compress the abdomen. Oblique. Slanted or at an angle. Rectus. Straight alignment with the vertical axis of the body. Rectus abdominis. Abdominal muscle with a straight alignment. Sphincter. Ring-like muscle that tightly constricts the opening of a passageway. Anal sphincter. Closes the anus. Transverse. In a crosswise direction. Transverse abdominis. Abdominal muscle with a crosswise alignment. Biceps brachii. Muscle of the anterior upper arm that flexes the elbow and is formed from two divisions. Biceps. Common term for biceps brachii. Triceps brachii. Muscle of the posterior upper arm that extends the elbow and is formed from three divisions. Triceps. Common term for triceps brachii. Gluteus maximus. Largest muscle of the buttock. Deltoid muscle. Muscle shaped like an inverted triangle or the Greek letter delta forms the muscular cap of the shoulder. Hamstring. Located at the back of the upper leg consisting of three separate muscles. Exercise physiologist. Specialist who develops, implements, and coordinates exercise programs and administers medical tests to promote physical fitness. Neurologist. Physician who specializes in treating the causes of paralysis and similar muscular disorders in which there is a loss of function. Physiatrist. Physician who specializes in physical medicine and rehabilitation with the focus of restoring function. Rehabilitation. Restoration following disease, illness, or injury of the ability to function in a normal or near normal manner. Rheumatologist. Physician who specializes in the diagnosis and treatment of arthritis and disorders characterized by inflammation in the joints and connective tissues. Sports medicine physician. Specializes in treating sports-related injuries of the bones, joints, and muscles. Fasciitis or fasciitis. Inflammation of a fascia. Fibromyalgia syndrome. Debilitating chronic condition characterized by fatigue, diffuse and or specific muscle, joint, or bone pain and a wide range of other symptoms. Debilitating. Causing weakness. Tenodynia. Pain in a tendon. Tenalgia. Another term for tenodynia. Tendinitis. Inflammation of the tendons caused by excessive or unusual use of the joint. Tendinitis, tendonitis. Other terms for tendinitis. Chronic fatigue syndrome. Debilitating and complex disorder of unknown cause characterized by profound fatigue that affects many body systems. Adhesion. Band of fibrous tissue that holds structures together abnormally. Atrophy. Weakness or wearing away of body tissues and structures. Myalgia. Tenderness or pain in the muscles. Myodynia. Another term for myalgia. Myocele. Herniation of muscle substance through a tear in the fascia surrounding it. Hernia. Protrusion of a part or structure through the tissues normally containing it. Myolysis. Degeneration of muscle tissue. Degeneration. Deterioration or breaking down. Deterioration. Process of becoming worse. Myomalacia. Abnormal softening of muscle tissue. Myorexis. Rupture or tearing of a muscle. Polymyositis. Muscle disease characterized by the simultaneous inflammation and weakening of voluntary muscles in many parts of the body. Sarcopenia. Loss of muscle mass, strength, and function that comes with aging. Muscle tone. State of balanced muscle tension that makes normal posture, coordination, and movement possible. Tonus. Another term for muscle tone. Tonic. Pertaining to muscle tone. Atonic. Lacking normal muscle tone or strength. Dystonia. Condition of abnormal muscle tone that causes the impairment of voluntary muscle movement. Hypertonia. Condition of excessive tone of the skeletal muscles. Hypotonia. Condition in which there is diminished tone of the skeletal muscles. Myotonia. Neuromuscular disorder characterized by the slow relaxation of muscles after a voluntary contraction. Ataxia. Inability to coordinate muscle activity during voluntary movement. Dystaxia. Mild form of ataxia. Partial ataxia. Another term for dystaxia. Contracture. Permanent tightening of fascia, muscles, tendons, ligaments, or skin. Intermittent claudication. Pain in the leg muscles that occurs during exercise and is relieved by rest. Intermittent. Coming and going at intervals. Claudication. Limping. Spasm. Sudden, violent, involuntary contraction of one or more muscles. Cramp. Localized muscle spasm named for its cause. Spasmodic torticollis. Stiff neck due to spasmodic contraction of the neck muscles that pull the head toward the affected side. Spasmodic. Relating to a spasm. Torticollis. Contraction or shortening of the muscles of the neck. Bradykinesia. Extreme slowness of movement. Dyskinesia. Distortion or impairment of voluntary movement such as a tic or spasm. Tic. Spasmodic muscular contraction that often involves parts of the face. Hyperkinesia. Abnormally increased muscle function or activity. Hypokinesia. Abnormally decreased muscle function or activity. Myoclonus. Sudden, involuntary jerking of a muscle or group of muscles. Nocturnal myoclonus. Jerking of the limbs that can occur normally as a person is falling asleep. Nocturnal. Pertaining to night. Syngultus. Myoclonus of the diaphragm that causes the characteristic hiccup sound with each spasm. Hiccups. Common term for syngultus. Myasthenia gravis. Chronic autoimmune disease that affects the neuromuscular junction and produces serious weakness of voluntary muscles. Myasthenia. Muscle weakness. Gravis. Grave or serious. Muscular dystrophy. Describes a group of more than 30 genetic diseases that are characterized by progressive weakness and degeneration of the skeletal muscles that control movement without affecting the nervous system. Muscular dystrophies. The proper term for muscular dystrophy. Duchenne muscular dystrophy. Most common form of muscular dystrophy affects primarily boys with onset between the ages of 3 and 5 years. The disorder progresses rapidly so that most of these boys are unable to walk by age 12 and later need a respirator to breathe. Becker muscular dystrophy. Very similar to, but less severe than, Duchenne muscular dystrophy. Repetitive stress disorders. A variety of muscular conditions that result from repeated motions performed in the course of normal work, daily activities, or recreation. Compartment syndrome involves the compression of nerves and blood vessels due to swelling within the enclosed space created by the fascia that separates groups of muscles. Overuse injuries. Minor tissue injuries that have not been given time to heal. Overuse tendinitis. Inflammation of tendons caused by excessive or unusual use of a joint. Myofascial pain syndrome. Chronic pain disorder that affects muscles and fascia throughout the body, produces local and referred muscle pain. Trigger points. Tender areas that most commonly develop where fascia comes into contact with a muscle. Referred pain. Describes pain that originates in one area of the body but felt in another. Impingement syndrome. Occurs when inflamed and swollen tendons are caught in the narrow space between the bones within the shoulder joint. Rotator cuff tendinitis. Inflammation of the tendons of the rotator cuff, often named for the cause. Tennis shoulder or pitcher shoulder. Other terms for rotator cuff tendinitis. Ruptured rotator cuff. Develops when rotator cuff tendinitis is left untreated or if the overuse continues. Carpal tunnel syndrome. Occurs when the tendons that pass through the carpal tunnel are chronically overused and become inflamed and swollen. Carpal tunnel. Narrow, bony passage under the carpal ligament that is located on 1/4 of an inch below the inner surface of the wrist. Carpal. Pertaining to the wrist. Paresthesia. Abnormal sensation such as burning, tingling, or numbness. Carpal tunnel release. The surgical enlargement of the carpal tunnel or cutting of the carpal ligament to relieve nerve pressure. Ganglion cyst. Harmless fluid-filled swelling that occurs most commonly on the outer surface of the wrist. Epicondylitis. Inflammation of the tissues surrounding the elbow. Lateral epicondylitis. Characterized by pain on the outer side of the forearm. Tennis elbow. Common name for lateral epicondylitis. Medial epicondylitis. Characterized by pain on the palm side of the forearm. Golfer's elbow. Common term for medial epicondylitis. Hill spur. Calcium deposit in the plantar fascia near its attachment to the calcaneus bone. Plantar fasciitis. Inflammation of the plantar fascia on the sole of the foot. Sprain. Injury to a joint that involves a stretched or torn ligament. Strain. Injury to the body of a muscle or to the attachment of a tendon. Shin splint. Painful condition caused by the muscle tearing away from the tibia. Hamstring injury. A strain or tear on any of the 3 hamstring muscles. Achilles tendinitis. Painful inflammation of the Achilles tendon caused by excessive stress. Spinal cord injury. Occurs when a vertebra is broken and a piece of the broken bone is pressing into the spinal cord. Can also occur if the vertebrae are pushed or pulled out of alignment. Incomplete spinal cord injury. Injury in which a person has some function below the level of the injury even though that function isn't normal. Complete spinal cord injury. Injury in which there is complete loss of sensation and muscle control below the level of the injury. Paralysis. Loss of sensation or voluntary muscle movements through disease or injury to its nerve supply. Myoparesis. Weakness or slight muscular paralysis. Hemiparesis. Slight paralysis or weakness affecting one side of the body. Hemiplegia. Total paralysis affecting only one side of the body. Hemiplegic. Individual affected with hemiplegia. Paraplegia. Paralysis of both legs and the lower part of the body. Paraplegic. Individual affected with paraplegia. Quadriplegia. Paralysis of all 4 extremities. Quadriplegic. individual with quadriplegia. Cardioplegia, paralysis of heart muscle. Cardiac arrest, common term for cardioplegia. Deep tendon reflexes, tested with a reflex hammer that is used to strike a tendon. Reflex, automatic involuntary response to some change either inside or outside the body. Range of motion testing, diagnostic procedure to evaluate joint mobility and muscle strength. Range of motion exercises, used to increase strength, flexibility, and mobility. Electromyography, diagnostic test that measures the electrical activity within muscle fibers in response to nerve stimulation. Electromyogram, record resulting from a diagnostic test of electrical activity within muscle fibers. Electroneuromyography, diagnostic procedure for testing and recording neuromuscular activity by the electric stimulation of the nerve trunk that carries fibers to and from the muscle. Nerve conduction studies, another term for electroneuromyography. Antispasmodic, medication administered to suppress smooth muscle contractions of the stomach, intestine, or bladder. Anticholinergic, another term for antispasmodic. Atropine, an antispasmodic that can be administered preoperatively to relax smooth muscles during surgery. Skeletal muscle relaxant, medicine administered to relax certain muscles and to relieve the stiffness, pain, and discomfort caused by muscle injuries. Neuromuscular blocker, drug that causes temporary paralysis by blocking the transmission and nerve stimuli to the muscles. Neuromuscular blocking agent, another term for neuromuscular blocker. Adjunct, in addition to. Ergonomics, study of the human factors that affect the design and operation of tools and the work environment. Occupational therapy consists of activities to promote recovery, rehabilitation, and performance of activities of daily living. Activities of daily living, activities like bathing, grooming, brushing teeth, eating, and dressing. Physical therapy, treatment to prevent disability or to restore functioning. Myofascial release, specialized soft tissue manipulation technique. Therapeutic ultrasound, utilizes high-frequency sound waves to treat muscle injuries by generating heat deep within muscle tissue. RICE, most common first aid treatment of muscular injuries. Fasciotomy, surgical incision through the fascia to relieve tension or pressure. Fascioplasty, surgical repair of fascia. Tenodesis, surgical suturing of the end of a tendon to a bone. Tenolysis, release of a tendon from adhesions. Tendolysis, another term for tenolysis. Tenectomy, surgical resection of a portion of a tendon or tendon sheath. Tenonectomy, another term for tenectomy. Resection, removal of tissue or part or all of an organ by surgery. Tenoplasty, surgical repair of a tendon. Tendinoplasty, another term for tenoplasty. Tenorrhapy, surgical suturing together of the divided ends of a tendon. Tenotomy, surgical division of a tendon for relief of a deformity caused by the abnormal shortening of a muscle. Tendotomy, another term for tenotomy. Myectomy, surgical excision of a portion of a muscle. Excision, cutting out or removal. Myoplasty, surgical repair of a muscle. Myopathy, surgical suturing of a muscle wound. Myotomy, surgical incision into a muscle. Central nervous system, receives and processes information and regulates all bodily activity, includes the brain and spinal cord. Peripheral nervous system, transmits nerve signals to and from the central nervous system, includes 12 pairs of cranial nerves and 31 pairs of peripheral spinal nerves. Nerve. One or more bundles of neurons that connect the brain and the spinal cord with other parts of the body. Tract. Bundle or group of nerve fibers located within the brain or spinal cord. Ascending nerve tracts. Carry nerve impulses toward the brain. Descending nerve tracts. Carry nerve impulses away from the brain. Ganglion. Nerve center made up of a cluster of nerve cell bodies outside the central nervous system. Innervation. Supply of nerves to a specific body part. Plexus. Network of intersecting spinal nerves. Receptors. Sites in the sensory organs that receive external stimulation. Stimulus. Anything that excites a nerve and causes an impulse. Impulse. A wave of excitation transmitted through nerve fibers and neurons. Neurons. Basic cells of the nervous system. Brain waves. Patterns of neuron electrical activity. Afferent neurons. Neurons which emerge from sensory organs and the skin to carry impulses toward the brain and spinal cord. Afferent. Toward. Sensory neurons. Another term for afferent neurons. Connecting neurons. Neurons which link sensory and motor neurons. Associative neurons. Another term for connecting neurons. Efferent neurons. Neurons which carry impulses away from the brain and spinal cord toward the muscles and glands. Efferent. Away from. Motor neurons. Another term for efferent neurons. Dendrites. Root-like processes that receive impulses and conduct them to the cell body. Axon. Process that extends away from the cell body and conducts impulses away from the nerve cell. Terminal end fibers. Branching fibers at the end of the axon that lead the nervous impulse from the axon to the synapse. Synapse. Space between two neurons or between a neuron and a receptor organ. Neurotransmitters. Chemical substances that make it possible for messages to cross from the synapse of a neuron to the target receptor. Acetylcholine. Neurotransmitter released at some synapses in the spinal cord and at neuromuscular junctions. It influences muscle action. Dopamine. Neurotransmitter released within the brain, believed to be involved in mood and thought disorders and in abnormal movement disorders. Endorphins. Naturally occurring substances that are produced by the brain to help relieve pain. Norepinephrine. Neurotransmitter released at synaptic nerve endings, responds to hypotension and physical stress. Serotonin. Neurotransmitter released in the brain, has roles in sleep, hunger, and pleasure recognition, sometimes linked to mood disorders. Glial cells. Provide support and protection for neurons. Myelin sheath. Protective covering made up of glial cells. White matter. Portion of the nerve fibers that are myelinated. Myelinated. Having a myelin sheath. Gray matter. Portion of the nerve fibers that are unmyelinated. Unmyelinated. Lacking a myelin sheath. Meninges. System of membranes that enclose the brain and spinal cord of the central nervous system. Dura. Thick, tough, outermost membrane of the meninges. Dura. Hard. Matter. Mother. Epidural space. Inner surface of the vertebral column. Subdural space. Located between the dura mater and the arachnoid membrane in the skull and vertebral column. Arachnoid membrane. Second layer of the meninges located between the dura mater and the P mater, resembles a spider web. Arachnoid. Having to do with spiders. Subarachnoid space. Located below the arachnoid membrane and above the P mater, contains cerebrospinal fluid. P mater. Third layer of the meninges, located nearest to the brain and spinal cord. Pia. Tender or delicate. Cerebrospinal fluid. Clear, colorless, and watery fluid that flows throughout the brain and around the spinal cord. Spinal fluid. Common term for cerebrospinal fluid. Cerebrum. Largest and uppermost portion of the brain. Cerebral. Pertaining to the cerebrum or to the brain. Cerebral cortex. Outer layer of the cerebrum which is made up of gray matter and is arranged in deep folds known as fissures. Fissure. Normally occurring deep groove. Cerebral hemispheres. Two divisions of the cerebrum that are connected at the lower midpoint. Corpus callosum. Connects the left and right cerebral hemispheres. Left cerebral hemisphere. Controls the majority of functions on the right side of the body. Right cerebral hemisphere. Controls most functions on the left side of the body. Cerebral lobes. Paired subdivisions of the cerebral hemisphere. Frontal lobe. Controls skilled motor functions, memory, and behavior. Parietal lobe. Receives and interprets nerve impulses from sensory receptors in the tongue, skin, and muscles. Occipital lobe. Controls eyesight. Temporal lobe. Controls the senses of hearing and smell and the ability to create, store, and access new information. Thalamus. Produces sensations by relaying impulses to and from the cerebrum and the sense organs located below the cerebrum. Hypothalamus. Performs 7 regulatory functions located below the thalamus. Cerebellum. Second largest part of the brain located at the back of the head below the posterior portion of the cerebrum. Brainstem. Stalk-like portion of the brain that connects the cerebral hemispheres with the spinal cord. Midbrain and pons. Provide conduction pathways to and from the higher and lower centers in the brain. Also control reflexes from movements of the eyes and head in response to visual and auditory stimuli. Medulla. Controls basic survival functions. Spinal cord. Long, fragile tube-like structure that begins at the end of the brainstem and continues down almost to the bottom of the spinal column. Peripheral. Pertaining to body parts that are away from the center of the body. Autonomic nerve fibers. Carry instructions to the organs and glands and from the autonomic nervous system. Sensory nerve fibers. Receive external stimuli and transmit this information to the brain to be interpreted. Somatic nerve fibers. Convey information that controls the body's voluntary muscular movements. Motor nerve fibers. Another term for somatic nerve fibers. Cranial nerves. 12 pairs of nerves originating from the undersurface of the brain. Peripheral spinal nerves. 31 pairs of nerves grouped together and named based on the region of the body they innervate. Autonomic nervous system. Controls the involuntary actions of the body. Homeostasis. Process of maintaining the constant internal environment of the body. Sympathetic nervous system. Prepares the body for emergencies and stress. Parasympathetic nervous system. Returns the body to normal after a response to stress and maintains normal body functions during ordinary circumstances. Anesthesiologist. Physician who specialized in administering anesthetic agents before and during surgery. Anesthetist. Medical professional who specializes in administering anesthesia but is not a physician. Neurologist. Physician who specializes in diagnosing and treating diseases and disorders of the nervous system. Neurosurgeon. Physician who specializes in surgery of the nervous system. Psychiatrist. physician who specializes in diagnosing and treating chemical dependencies, emotional problems, and mental illness. Psychologist, specialist who evaluates and treats emotional problems and mental illness, holds an advanced degree but is not a medical doctor. Cephalalgia, pain in the head. Headache, common term for cephalalgia. Migraine headache, characterized by throbbing pain on one side of the head, can be preceded by a warning aura. Warning aura, sensation perceived by the patient that precedes a migraine. Cluster headaches, intensely painful headaches that affect one side of the head and may be associated with tearing of the eyes and nasal congestion. Encephalocele, congenital herniation of brain tissue through a gap in the skull. Congenital, present at birth.